Hi students! Hey, welcome to the first edition of Chair Chats with Dr. Chasek. So this is an idea that's been forming a little bit in my head about ways that I can communicate with all of you because I just don't get to see everybody in the program that often. You know, I teach a few classes here and there, but I just don't get to be able to connect with you as much as I want. So I thought maybe this is a way that we can connect and talk, and you can find out what's going on in the program. So I know, people have questions, wonder. Communication is such a big part of what we do, and you're a big part of what we do. So I'm going to give this a shot, see what we think, and any feedback definitely is helpful. So chats with Dr. Chasek. Here's my coffee. Oh, it even says faculty on it. That's awesome. So, and I have a list of things to start us off with. So I just want to welcome you. We're almost halfway through this semester, which is amazing. Next week is fall break. And I know you're looking forward to a few days off. And so that'll be great. What it also means is that registration will start. And I have had some communication with some of my advisees about advising and what classes you need to take next, those kinds of things. So a couple important things when you're getting ready to register. Definitely, if you have questions or concerns, reach out to your advisor. If you don't know who that is, actually email the graduate assistants. They kind of keep track of who advises who. So they would be good sources of information. Or, of course, myself or even Barb, the administrative assistant, could assist you. So the other thing there, as far as advising and courses, there will be a new plan of study document, a rotation being put up on the website. And the website is your go-to place for different kinds of documentation. If you go to Students and Forms on the counseling website, you can find lots of things like practicum manual, student handbook, and advising. So the rotation of courses is up there. It does expire in summer of 2023, so we're working on a new one. One really important thing is just to follow your plan of study. On the documents, there's a sample plan for full-time or part-time. That is really helpful in trying to pick which classes you need before you get to practicum. So there's prerequisites and there's co-requisites. Co-requisites means you take them at the same time. So you can take, let's say, child and adolescent counseling at the same time as practicum. But before the prerequisites, you have to have them before practicum. So things like DSM, group, advanced theory, those kinds of things. So we also want you to know that, stacking your courses and trying to cram a whole bunch in is not going to get you to practicum any faster. The plan that's online is the quickest. It usually takes about 4 semesters with summers in there to get to practicum. And it's just, so if you go early, you're still going to need classes and you might get a little frustrated because you thought you could get there earlier, and really it doesn't work with all the prereqs and co-reqs. Mostly this comes from our K-CREP accreditation, that we have to have certain things in place before you start seeing clients. And it just makes good sense, right? So the child and adolescent co-req, pay attention to that one. You definitely will need to have that at the same time as practicum coming up because we're going to see more and more kids. And you need that information. Speaking of practicum, there has been a change in how we get you started. And so Dr. Abby, so I call her Dr. Abby, as a clinical training director, has been working really hard to get the clinic up to speed in terms of seeing clients, making it a warm, inviting space. And developmentally, it makes a lot of sense to have you do your practicums in our clinic, just because there is supervision, there's oversight, there's faculty available. And we've had a little trouble with community pracs. They're not investing in the supervision as much as we need them to, or we would like to, because they're busy, right? And I think a lot of this has come around since the pandemic. They're busy, they're having a hard time getting the supervision in. So we are making a switch for practicum to be in the clinic. And when you go to the orientation, which is required before your practicum, Dr. Abby will give you all that information. All right, another point is group. So when you do, before you graduate, you have to have the group counseling experience, which is outside of classes. So make sure when those come up, you sign up for them. And we have a clinician who does those for us. So sometimes scheduling gets a little bit difficult, but we'll make every effort to make sure you get those 10 hours of group counseling in. And again, that's a K-CREP requirement. All right, well, we are on K-CREP. There's been some rumors going around that we're losing K-CREP accreditation. That is definitely not true. We are accredited through 2024 in the clinical mental health and the school counseling. Right now, faculty and myself are writing the next study, and so probably in another year we will have a site visit and we'll be on to the next cycle of accreditation. So don't worry, K-CREP accreditation for your clinical mental health is secure. That maybe the rumors came from the school counseling side, which is K-CREP changed some of their standards. They increased the hours required for school counseling up to 60. So what that means is that we would have to update and add more classes for school counseling, and that would push school counseling to 60 hours plus 12 if you didn't have the teaching certificate. Essentially, you're getting close to PhD level at 72 hours of credit. So we have decided to move our accreditation in school counseling over to the state accreditation, which allows us then to keep the same number of credit hours and not increase the cost for students who are interested in school counseling. So, okay, the last thing I want to talk a little bit about is paid internships. We have had a big shift in our field and our industry around internships and paid internships. So you are allowed to have paid internships going forward. That hasn't been the case in the past, mainly because interns billing or being paid for services for which they're not yet licensed to do has been a problem. So we've done some checking with insurance, with student insurance, the ACA ethical codes, and just places around Nebraska. And paid internships now are available. So the only concern, and that you have to watch out for, is that you are doing your clinical hours when you're at your internship. So if you're being paid, you have to be doing hours that contribute to your license hours for graduation. So what that means is you can't be paid to mop the floor. You can't be paid to do tasks that don't require direct contact or support for a client around paperwork or any of those kinds of things. So when in doubt, definitely ask, about hours and how you accrue those. It's probably one of the biggest questions, and I know Dr. Abby fields a lot of those. And so, she is a good source of information when you get to that step. We are writing a grant, and hopefully, knock on wood, we will get the grant. It's due on Friday, to be able to offer some stipends, more of a living stipend for students as they're going through their internships. And I think many other places across the metro area and surrounding areas are moving more towards paid internships. So don't be afraid to ask about that and figure out a way, hopefully, that you can, earn some money while you're doing your internship. I know it's hard, and it's hard to have a full-time job with an internship or even part-time because you're spending so much time getting your clinical hours. All right, we couple more things here just on the list for the first chair chats. This is long because we have so much to go over. We will have an opening for a GA starting next academic year, so fall 2023. So look for that next semester if you've ever thought about being a GA or applying. Your opportunity will be in the spring. And we are also hiring for a new faculty person to join us in the fall of 2023. So some of you know Dr. Tolliver left academia this semester, and so we have an opening, which is making things a little bit hectic, especially for Tang Tran in the schools, but he's doing a great job, and we just really appreciate your patience on that front. If you have questions about your school to mental health certificate or hours or trying to be licensed, I'm taking that over and can be helpful that way, hopefully, and then Mr. Tran does all the school counseling advising. Student affairs, we don't want to forget you. Ashley, Dr. Blount has been out on leave and should be back soon. But if you have any issues, definitely contact me. I'm filling in probably not as well as I could be, but we're trying to do that. And I definitely we are just really excited about the student affairs program because we are going to modify the curriculum a little bit, kind of lower some of the credit hours so that people can take advantage of some other opportunities for credit if you work in an institution, for them to be paid. So that's another neat thing. All right, I think I've talked your ear off enough. I'm going on 10 minutes. This is going to take forever to render. But I'm just so glad and proud and privileged to be the chair of the department. And if you're ever in Roskins and I am here, if I happen to be here and not on a meeting, knock on my door. Otherwise, I definitely am available by email. And so give a shout out. And we'll see you next month when we have the next chair chat with Dr. Chasek. So take care, everybody. Have a good fall break. Bye-bye.